Hello and welcome back to The Path, the podcast from Lifestyle RX. My name is Dan, and joining me as always this week is Dr. Brendan Byrne. How are you doing today?
I'm doing great. I had a very good night's sleep.
Excellent. That's going to guide into the topic for this week, which is what to do if you're not sleeping well. So we're going to talk all about sleep. I think this is part one, so there's going to be some more parts to this in future episodes. But for now, let's jump into it. So I guess first thing we'll go over is, why is sleep part of our the 4+2 diabetes reversal strategy? Why is sleep so integral to this program?
So sleep is one of the +2s, right? And so I kind of call them wild cards. And so if you're sleeping well and all is good with your sleep, then it may not be a factor at all. That being said, a lot of people in general have trouble with sleep, and a lot of people with type 2 diabetes have trouble with sleep. And when you have trouble with sleep, it tends to activate cortisol. And so we think of cortisol sometimes as in the morning, it's our get up and go hormone, but it is our stress hormone. And cortisol has a whole bunch of effects that kind of make insulin resistance worse. So people that aren't sleeping well get higher cortisol levels, and those higher cortisol levels contribute to further insulin resistance. So it's kind of like headwind as you're trying to make all these other changes if you're not sleeping. And I always kind of joke with people, it's like, you might be able to lose weight by sleeping better, which seems like a pretty good deal compared to when I'm usually telling them to get up and go exercise in the morning.
Yeah, definitely. Okay, so then I guess next question is, does everyone have to work on their sleep, or how do you make your sleep better, I guess?
Yeah, so short answer is no. If some people have very good sleep, and so I usually have kind of a number of questions that I'll ask. So, do you feel tired when you awaken? Right. So when you get up in the morning, do you feel tired? Are you exhausted all day? Can you fall asleep easily at any time during the day? And so essentially, if you don't feel tired when you wake up, you feel good and refreshed, you're not exhausted, you don't feel tired during the day, and you don't fall asleep easily, then you're probably just fine. And that, no matter what your watch says, or no matter what your Oura ring says, or no matter how hours, if you actually feel rested during the day and feel good and have lots of energy, then you actually really don't have a sleep issue. The third one there is really important though, right? So if you fall asleep super easily, right? So you sit down to read and you always fall asleep. You sit down to watch TV and you fall asleep. You're on a bus and you fall asleep, especially if you're on a bus and fall asleep and miss your stop. Lying down, kind of anytime you kind of lie down, if you fall asleep really quickly, if you're falling asleep that quickly, that may be something that we have to look at. And so kind of we call it excessive daytime sleepiness. And then generally there's a few more questions that I'll generally go into with people. Have you ever been told that you stop breathing at nighttime? And so something called apnea, where you stop breathing. Do you snore loudly? And do you have high blood pressure? Kind of if you have that if you have that excessive daytime sleepiness and you have two of the three screening questions positive, then you meet the criteria to do a sleep assessment. And then there's one other question that comes to mind around sleep, which is, do you do shift work? And so anybody that does shift work, it's so difficult on your system. You really have to have a good strategy all the way around that sleep. So that's one worth discussing. But if you feel fine and you're not exhausted and you don't have that daytime sleepiness, then you can just skip the sleep week.
Nice. Okay, so let's say I feel tired during the day and I don't feel refreshed when I wake up, but I don't have any of those sleep apnea symptoms. What's the approach then for improving sleep?
Yeah, so then what we want to do is go a little bit deeper, right? And we want to start to kind of understand like, is it that you're having trouble falling asleep? Is it having trouble staying asleep? We also want to look at other factors. And so one of the big things to kind of consider, and this is what your doctor at Lifestyle RX will be doing, is looking at kind of other things going on. Do you have any condition that would affect your sleep? So obviously, if you're in pain, that's going to affect your sleep, right? So it could be something acute, like an injury, or it could be something chronic, like arthritis, or chronic nerve pain, or just what we call chronic pain, where you're getting pain from part of your body and there's it's unresolving. You get chest pain from angina. Obviously, that can affect your sleep. But if you're getting chest pain at night, you probably are very concerned about that already. Breathing, if you're short of breath and it's asthma or COPD or heart failure, that's going to really affect your sleep. And obviously, the priority is going to be dealing with the root cause. Sometimes just nuisance things like heartburn, or digestive symptoms, or really, really commonly urination, right? Men as they get older tend to get enlarged prostates, and as you get enlarged prostate, you have to go to the bathroom more frequently, and often that means getting up once or twice a night. Usually, one of the things I look at is, getting up once a night's pretty normal. Getting up twice a night, if there's not a urine issue, then we actually want to look at your sleep a little bit more. Menopause. So women going through menopause or perimenopause, there's a whole combination of factors that affect sleep, and including hot flushes, itching, tingling, right? So if you've got a skin rash that's itching, that might affect your sleep, or you have a chronic condition that gives you some itching, and then one of the kind of more chronic sleep problems we see is restless leg syndrome. And so basically you go to bed and your legs just feel like, they're antsy and they feel like they have to move. So we want to take all those things into consideration. And obviously, if one of those things is the factor, then addressing that root cause is going to make the most sense. Other things that we look at are medications. And so there are a lot of different medications, but we tend to look at it from the standpoint of, are you on things that can stimulate your nervous system? Are you on things that depress your nervous system? So anything that's going to affect your nervous system may have kind of an effect on sleep. Bronchodilators, things that you use for asthma, often can, if you're using them, especially close to bed, they have stimulants and they can affect your sleep. Some antidepressants will boost you. Some antidepressants will actually make you sleep more easily. Beta blockers can affect your sleep. So they're medications that we use for blood pressure or for heart disease. Diuretics, obviously, if you're going to the bathroom more frequently. Steroids, right? If you're on glucose corticoids for any of the arthritis, that you often, especially if you're taking a higher dose for a while, it can really amp you up and you can really kind of feel charged. Same with caffeine. And then, one that sometimes people will say makes them sleep better, alcohol. In fact, you're more likely to fall asleep with alcohol, but it really destroys your sleep. And so you often get poor quality sleep. So we kind of want to go through those and understand if there's, any, you're taking anything there. And then what we look at, if you are, it becomes, is it something that you're taking transiently, in which case, we can work around it, or is it something that, maybe there's an alternative that we can use, or maybe we can adjust the dosing such that it's not going to affect your sleep as much. And then kind of the third other factor we look at is acute stress, right? So, if something major's happened to you, then your inability to sleep may be very much explained by what's happening there. And so then obviously, again, kind of same sort of principle, we look at that as being kind of the root cause and what can you do to support that acute stress response. So those are kind of, what we look at, and we're then trying to figure out, is the sleep a problem, or is it something else that's really the problem is sleep. The lack of sleep is just a symptom.
Cool.
So the first thing that we do once we've cleared all that away and we say, no, you know what, there's no other issues, there's no medications, there's nothing kind of acutely going on from a stress perspective, we address something called sleep hygiene.
What is it, like taking a shower before bed? What's sleep hygiene?
It's such a funny name, but it's not about having a shower before going to bed. Although having a hot shower before going to bed can help you sleep, and I'll talk about that in a bit. No, it's really kind of going through and looking at all the factors that are around you, right? So, what's your sleep timing like? Do you wake up at the same time? Do you go to bed at the same time? What do you do right before you go to sleep? What is your kind of nighttime habits? Do you have kind of a nighttime ritual? Do you do relaxation exercises or any stretching or any other things? We look at your environment, right? Is your bedroom dark? Is it quiet? Is it cool? Are you only using your bed for sleeping or sex? Hopefully you're not watching movies in your bed or playing video games or doing anything that's going to get you too charged up. So kind of along with that, we don't really want you to have a phone or computer in the bed, right? So you kind of should do those things outside of the bedroom. This one's kind of harder, no stressful conversations in bed. For a lot of couples, that might be the time where you kind of finally got your partner beside you. But really, having a stressful conversation right before you go to bed is not going to be super helpful. And then the ones that I kind of have fun with, especially in our groups, I'll do you have a comfortable bed, right? Do you have a comfortable pillow? Do you have comfortable sheets? You're spending a third of your life sleeping. You should have really good bedding, right? It really is worth it. And so it's something that you can, it's a good investment to make, put it that way. Then we look at kind of what you do during the daytime. Are you exercising during the day? So, do you have a reason to be physically tired when you go to sleep? Obviously, if you don't do anything all day, maybe you're just not physically tired enough to sleep when you're planning to. So we want some exercise during the day, but not too close to bedtime. Because if you do it too close to bedtime, again, it activates you. So you usually get kind of a stress response. You get adrenaline and cortisol released with the exercise.
Yeah.
With kind of what you're doing in the day, did you get outside? One of the things I sometimes notice, especially because I'm working from home now, is I've got to get outside during the day, right? And sometimes I don't get outside till later in the evening when I go for a run. I've actually not seen the sunlight. This is a horrible thing to admit, like a vampire or something. But the difference between the light intensity, even on a cloudy day, it's so important because one of the hormones that helps trigger sleep is melatonin. And melatonin, the stimulus for creating melatonin is actually light during the daytime. So you really do need that light in the daytime. Napping, right? Like, are you napping during the daytime, right? If you're not sleeping at night, then, and you're not happy about your sleep at night, there is no room for napping in the daytime. You're just going to make things worse. So really what we want to try to do is get that nighttime sleep kind of optimized and then by cutting out the napping. If you're sleeping really well at nighttime and you enjoy a short nap in the afternoon and it doesn't affect your sleep, then by all means. And there's some people that will do that more from they kind of, reset their brain a little bit. So that it's often kind of brain fatigue can get relieved by a nap. But you really don't want it to affect your nighttime sleep. Mm-hmm. And then the other thing during the day is keeping yourself well hydrated, so that you're actually well hydrated. And then kind of the corollary of that is so you're not drinking too much water at nighttime, which will obviously get you up to going to the bathroom more often. So when we look at kind of other things with food or drink, your evening meal, you want to have that at least 2 hours before you go to bed. You don't want to be trying to digest a big meal right before you go to bed. It will really affect your sleep. You don't want to have that water right before bedtime as well. We've talked about alcohol already, and probably the last thing, and for some of us, one of the more important things is how much caffeine have you had and when did you have it?
Mm.
People vary in terms of their metabolism of caffeine, but some people are fast metabolizers. They get rid of that within a couple of hours. Some people are slow metabolizers, meaning that it takes them 10 hours or so, and it's a half-life, right? So if you have 3 cups of coffee in the morning and you're a slow metabolizer, you still might have like a cup of coffee in your system at bedtime. So what I found in practice, though, and we used to do genetics at my lifestyle clinic, people who are slow metabolizers, they know it, because they just get wiped. Their sleep gets wiped out by coffee.
That's definitely me. If I have
Yeah,
any coffee anytime after lunch, can't sleep.
yeah.
Yeah.
If you're a fast metabolizer, you often think you know it. But what I've found is there are a lot of people who are kind of the intermediary, where that's about 5 hours,
Mm.
and you think they think they're fast metabolizers, and so they're not really worried about having a coffee, but it actually is building up in their system. And so it is kind of one of the fun genetic tests to see. I found out I'm a fast metabolizer, which kind of makes sense because I literally could have an espresso and go to sleep. It doesn't affect me, maybe not quite right at bedtime, but I can have it pretty late.
Yeah.
And interestingly, my wife is an intermediate metabolizer, and
Hmm.
so when she got this result back, it actually explained, because often we'll go out for dinner and I might order a coffee after dinner, and she would kind of go along with that and realize that that was actually not a good thing for her.
Yeah.
But it wasn't consistent, right? And that was the thing with kind of the people that are the intermediate metabolizers. Sometimes you get away with it. So again, kind of one of the things we want to think about and look at a little bit more. So more often than not, and obviously I went through just a giant list of stuff there, which, by the way, is in our sleep guide. It's in the week on sleep. There's a handout for it, just a checklist, and we probably should put it in the show notes.
Sure.
But that sleep hygiene, more often than not, even when it's not the primary issue, there's people improve by actually going through that list. And if you haven't gone through that list in 3 or 6 months, it's interesting to go back to it, because every time I look at it, there's always things like, oh yeah, you know what, I'm getting some bad habits here, or I'm getting into some bad habits there, and you can improve your sleep that way. So, what I will see a lot of times in practice is we go through that list, and actually everything kind of goes back to normal, and people start to feel well rested in the morning. They've got that energy. They're not falling asleep easily. And then we're pretty happy with things.
Okay, cool. And then so let's say you did all that sleep hygiene stuff, you implemented it all, and it's still not working. What's the next step? Still can't sleep.
Yeah. So the next step I kind of look at there is trying to optimize the sleep ritual, right? So really trying to look and say, okay, let's try to get a good wind down. And so kind of a couple hours before bed, kind of shutting down the screens, right? TVs, computers, phones, kind of, we know that the blue light from these
Mhm.
devices will suppress that melatonin release. And so
Yeah.
it's a problem. And often the content that you're kind of on with, right? You're on your computer and you're doing your work email, that's probably not the most relaxing thing to do.
Yeah.
Some of the shows we watch, of course, too, right? I actually will notice that one a fair bit. If I watch any show that's kind of dark, I often really do notice that kind of
Yeah.
not getting as good a night's sleep.
Or even the 11 o'clock news, like
Oh
the
yeah, the
always
news, news might be the worst.
yeah.
Um, so yeah, so anything also that can get your mind racing. So you kind of shut that out 2 hours before, and then usually an hour before. Again, we got to put a kind of, I have to put, I'm able to say all this because I'm newly empty nester, right? So our youngest just went off to university literally last week. So I'm acting like I've got all the time in the world in the evening. But I do know if you've got younger kids that this is more challenging to find 60 minutes. So 60 minutes would be ideal. Find whatever time you can, and then begin a process to relax, right? And so that could be reading, it could be some light yoga, it could be some meditation, and that's kind of where your hot shower or hot bath could come in. What happens there is if you have, if you have a hot tub, you could do hot bath, hot shower, you get in it, and because it's hot, your body starts to vasodilate in the skin, right? So you start to
Mm.
dilate all your, so it sounds kind of weird, because when you go into deep sleep, what has to happen is your core temperature has to drop. So you're having something hot in order to drop your core temperature, but it works because of that vasodilation. You're hot in the shower, but you get out of the shower and everything's kind of remains vasodilated, and your body goes to cool off, and it
Mm.
actually takes blood from the core, brings it up to the surface. But now, of course, the hot is gone, and it actually drops your core temperature quite nicely. So
Interesting.
it really is a good process to kind of stimulate a better night's sleep. So if you kind of line all that up and build something that you enjoy, then you can kind of get into a rhythm of it. And so I don't like people getting too obsessive with it, because again, this is something we want people to do as a lifestyle. It should be something that's enjoyable. How you do that with your spouse or partner, if you've got one, a little bit of negotiating there. Maybe that's you've got to kind of do something that works for both of you. But I always think about, like, when we have young kids, or when we were young kids, there was a little bit of sleep routine, right? Their whole kind of ritual in the
Yeah.
evening, right? So you'd have dinner and you got to play a little bit, and then then it was time for a hot bath, and you got your bath, and you got tucked into bed, and somebody that you loved would read a nice story to you, and you'd be relaxed, and boom, you'd fall asleep.
Yeah.
We kind of need to do the same thing for ourselves, and so it's kind of giving yourself permission to have just a wonderful send off to sleep can really help.
Yeah. Okay. Let's say that still doesn't work. Like, what's next? What's the next part of that solution?
So this is when we start to get into the territory of sleep therapy, right? And we're kind of trying to navigate our way through this. And so there is something called CBTI.
So it's like cognitive behavior therapy, right? That's the
Yeah.
CBT. Yeah.
Yeah. So cognitive behavioral therapy for insomnia, right? And so it's an approach that's very helpful. There are a whole bunch of tools that you can use that and here, you probably can figure out some of these yourself. So you could kind of read up on it. I think it is worthwhile to find somebody to work with it. But yeah, so there's some tools like sleep restriction, right? So or sleep compression, where you start to really try to squeeze kind of your sleep into a period so you're fully asleep for the whole time. And sometimes we do this quite naturally when as physicians, when we see people, and they're trying to they're trying to get a good night's sleep, but they're going to bed at like 7 o'clock at night and trying to wake up at 7 in the morning. Well, very few people need to sleep for 12 hours,
Yeah.
right? And so what's happening is they're trying out a lot of sleep pressure to begin with. They fall asleep, wake up, fall asleep. So we usually kind of naturally try to get that to a 7 or 8 hour window. But we can get more, we can, depending on kind of exactly where the issue is, we can compress it more to try to get kind of have sleep last a little bit longer, and then we can start to stretch it out again. But I do like having somebody to work with someone there. And then we're always coming back on that sleep hygiene, that checklist, right? And stimulus control. So there's more often than not, there's something that's kind of lurking there. And I can't tell you how many times, like with this program, and when I talk to people, they'll be like, I looked at that list and I realized this was a fact. And I just, I closed the door so the dog didn't come in. And oh my God, I feel so much better. And by the way, my blood sugars are better too. So yeah, it really is worth going through that list. Then, the relaxation methods. And so, there are some things that you can do around, breathing exercises or progressive muscle relaxation or mindfulness that you can learn, and again, tuck that into your sleep ritual kind of leading into bedtime. a sleep therapist can help with that. And then there's the cognitive therapy that often starts to result, because if you're really not sleeping, you can get into anxiety over this. And so I think we've all had it when we've, especially when you've got something big like an exam or something coming up.
Thinking about sleeping means it's harder to sleep. I always notice that. So if I'm worried I'm not going to sleep, then I don't sleep.
Oh, and it's a circular thing, because it's like literally you go to sleep and you get the thought, oh, I wonder if I can't sleep. Oh no, don't think that.
Yeah, exactly. Yeah.
So, and we can kind of joke about that in the sense that we've all experienced it, but some people really get into that. Like, it really is a problem. And so you have to develop some tools to recognize that it's a thought that can be let go of, and do some things so that you're able to kind of let go of that, and
the things that CBT is really good at helping with. Sure.
Yeah. And that's where, I find like clinical counselors that are trained in CBT, and have a background in sleep, can really just help you, right? You start to get a toolkit, you start to work with a therapist on that, and you can kind of get a bunch of this stuff figured out.
So I guess that sounds like if you're getting to that point, you need to work with someone. So how do you go about that?
Well, so this is something that isn't so easy to find. There are apps that do CBTI, but you don't really have that professional. So, what we're looking at doing at Lifestyle RX is working with some clinical counselors trained in CBT, and offering that as a for people going through this program. So that's something to stay tuned on. I think we're going to have that probably in the later half of this year.
Okay, I think we have time for one more question here. So, how does what's the connection between sleep and blood sugars, and how do those mix together?
Yeah, so we touched on this at the very beginning, but it really does come back to cortisol. So there is the dawn effect, and just to remind everybody, around kind of 4 or 5 in the morning, your body starts to release a little bit of cortisol to prepare you for getting up. And so cortisol, that stress hormone, is also the get up and go hormone. And so what happens to your blood sugars with that is essentially cortisol is a signal to the liver to produce a little bit more glucose. And so your blood sugars rise a little bit. If you're not diabetic, you can still see this. If you wear a continuous glucose monitor, you can still see this little rise. But if you are diabetic, you usually have some insulin resistance in the liver. And so the liver doesn't slow down. It gets the signal to produce more sugar, and it overdoes it, because it's not responding properly to the insulin to slow down that. And so that's what kind of gives you the morning rise. So if you're not sleeping, you'll see this on your CGM. You'll actually see that, the days that you have really poor night's sleep, you get much more of a cortisol response. And it's kind of like you're already awake, right? Because you are. And so you get like a daytime cortisol level in the middle of the night, and it shows up right away in your blood sugars. So it just skews everything upwards that way. And so, one of the things that you can start to see is, as you start to feel better with your sleep, you'll start to notice that your fasting blood sugar comes down really kind of to what your normal is at that point. And so, it's actually not a bad way, as long as there's not something serious like sleep apnea going on. It's not a bad way to figure out, are you, are all the things you're doing working? Because you might be kind of like, I think I'm not as tired, and I think I got more energy. But sometimes for people whose sugars are a little bit on the higher side, you'll really notice a difference. You're like, oh no, my blood sugar this morning was 6.5 instead of 8.5. So it can be that dramatically different.
Okay, awesome. All right, so we'll move on to our question of the day then for this week. So this question comes from someone that says, we're talking to Dr. Byrne here. I know you're Irish and you like potatoes, but aren't all potatoes out in the 4+2 diabetes reversal strategy?
I guess I'm a living stereotype. I do like potatoes. Of course, the center of the potato is just pure starch, right? So, and that starch breaks down into glucose very quickly. So, if you're having mashed potatoes, you're essentially eating pure glucose, right? So it's disappointing because I know a lot of people love mashed potatoes, but that probably doesn't work in the program at all. So kind of tucked on the red light carbs. But I want to give a shout out to Barbara J in the community who posted that not all potatoes are the same. And so there's a wonderful link here, and a bunch of people have commented on it. And there are different varieties of potatoes, and you can do some things. So you can have the smaller potatoes with their skins. Certain varieties seem to be better than others. And cooling them afterwards, the starch just doesn't get it. It's harder to break down again, and so you don't get as much of a glycemic load. So it basically gets absorbed a little bit more slowly. So bottom line, potatoes are never going to be green light foods, but they definitely can be a yellow light food. So the mashed potatoes are going to be in that red light, but you can have some of these little potatoes in the yellow light. And like with any yellow light food, you kind of need to figure out what your portion is going to be, and the CGM is really helpful to figure out that portion. So if you're not, if you're eating it and you don't spike, and then you're good. You can enjoy the potato, and the other thing I actually always got to remember is, remember what else you're eating with it, right? Yeah. So you have a whole bunch of veggies and lots of fiber there, and you've got some protein, and it's kind of the last thing that's on your plate, and all that other stuff's got to get digested first. It might not get it. You might not get much of a spike from that potato, so you can enjoy it.
Perfect. All right. Well, that's all the time we have for this week. So thank you all so much for listening. If you want to find out more about the show, you can check the show notes. We have links to all the stuff we talked about, and you can ask your questions there underneath. So leave your questions, and we will get to them in a future episode. If you're interested in the Lifestyle RX program and you're in Alberta, BC, or Ontario, it's covered by provincial medical insurance, and you can sign up at Lifestyle RX.